Mr. M is dual eligible, having both Medicare and Medicaid. He lives in public housing with his wife and 2 grown children. His medical history includes diabetes, hypertension, atherosclerosis, and end-stage renal disease. He is currently on kidney dialysis. Mr. M and his family are working with a healthcare transitions coach, as encouraged and provided by the hospital during his recent hospitalization. Mr. M's primary care physician has tools and resources at his fingertips, as provided by the Improving Health for Populations and Communities team. These resources have been provided to Mr. M to help him self-manage his chronic conditions, leading to increased patient engagement. Mr. M and his family visited the physician as directed after his discharge and are working with a transition coach for 3 weeks since his last discharge from the hospital. His patient activation measure score has improved, and Mr. M is very excited to now be able to self-manage his long history of chronic conditions, as he has set a personal goal to never have another amputation, and to be able to walk his daughter down the aisle when she gets married. Mr. M had been in the hospital for ongoing complications from his diabetes and end-stage renal disease. During his latest hospitalization, all of the toes on his left foot were amputated. He was then transferred to a skilled nursing facility for physical therapy. The hospital and the skilled nursing facility have been working together as part of a care transitions community to improve transfers and discharge communication between providers through working with the local Integrating Care for Populations and Communities team at the Quality Improvement Organization. The skilled nursing facility had protocols and interventions in place to provide safe care as a result of the Quality Improvement Organization's assistance through their local Improving Individual Patient Care team. As a result, he had no complications. Mr. M had a successful rehabilitation stay and was sent home after 30 days, walking with a cane. He was discharged and promptly made an appointment to see his primary care physician in 7 days. His physician had Mr. M's hospital records readily available due to his work with the local Health Information Exchange. As a result of great care and communication between and among healthcare providers, Mr. M's family felt comfortable with his plans for his hospital discharge and did not feel that he needed to call the Quality Improvement Organization and Beneficiary and Family-Centered Care team to appeal his discharge. The important message from Medicare notice described to Mr. M's family the right to appeal his discharge, as well as how to notify the QIO of a quality of care concern. The family felt well informed of his patient rights and responsibilities during this hospital stay. Mr. M is currently residing at home and is now a fully activated patient who understands how to self-manage his chronic conditions. He has not been readmitted to the hospital, has access to community resources for transportation to the dialysis center, community food pantry so that he can obtain fresh fruits and vegetables as dictated by his diet.